Hi, everyone. Welcome to the sleep webinar, the webinar on how to change your patients' lives and change your practices life, I guess, financial life. I'm Rob Breedlove. I am going to be the presenter today, and I'm glad to have you on today. So those of you that can't see the screen, by the way, we're going to be sending out this presentation. We're going to let you know. We'll get you an email to let you see it, and so on and so forth. Here we go. We're going to start in 1 minute. So just hang tight, everybody, and we'll get you going in 1 minute. Okay. It is 10:30. We're going to get started here. Welcome, everyone, to the webinar. Go ahead and if you like on there, I'm going to open this, put the chat on here. The chat's going to be a little delayed. The question and answers will be a little delayed, but go ahead and put your name in, where you're from. Type it there in the chat box. Love to see where everyone's from. And great. Who's on? Marshall, I see you there. Great. All right. Yeah, so let's see here. I'm going to scan through. Everybody do this. I want to look real quick. I'm going to let a couple people get on here and scan through some notes. Mr. Marshall. Okay, great. Scan through some things here. Good. Marshall's from sunny, water scarce California. Glad you're on, Marshall, and everyone else that's involved. We're going to go ahead and get started. So hang on to your hats here. Let's get this rolling. Welcome. Today we're going to be talking to you. I'm going to be focusing on teaching and talking and interacting with you on helping you help your patients and help your practice. And I say help your patients because, you know, when you treat sleep apnea, and that's what this presentation is about. If you thought it was about crowns or something else, you probably came to the wrong webinar. Today we're talking about sleep apnea. And we want to, no, my kids are not in school. We homeschool, so they're here. You're making this fun. Anyways, all right. So we're going to talk to you about changing your lives, changing your patients' lives, and changing the life of your practice. When patients get treated in a dental practice, they're usually quite happy. The most dentists that I know are quite happy, or they're focused on helping people. But what I want to focus on today is how you can literally save the life of your patient. Let me tell you a little story. Today, thank you. I'm glad I'm brave. I actually talked to a patient today. I went and met a patient at a dental practice this morning, and we were talking, and she said she had gone to a lecture with her husband about how to lessen stress in their life. And one of the main things they talked about was getting good sleep. And when I talked to her about how sleep apnea could actually kill her, but even worse, it could, or her husband, that's who we were testing, is her husband we were testing him and going over his test results with him. But so we were also talking about, excuse me, how rude of me, I didn't put my phone on vibrate. I'm going to do that right now. We were talking about how having a stroke or having a heart attack, which comes with sleep apnea, could change the life of your patient forever. And so I want to really help you focus on saving your patients' lives. And by doing that, I always tell dentists that I work with, and I work with a lot of dentists, if you'll focus on saving your patients and helping your patients, if you have the right system in place, the revenue will just follow. The revenue will follow. I mean, what I'm going to show you today is by helping 1 to 2 patients, you can see a tremendous 1 to 2 patients per day or per month, or per day is what we prefer, because it would do your patients so much better help, but how it can change your practice for good. All right. So with that, let's get started. I really want to talk to you, dentists. That's who this is for. I've noticed a lot of dentists, they talk to me and they say, hey, Rob, I want to treat larger conditions. What can we do? And my job is to help the dental practice and the dentist work on practice scenarios, office scenarios that will help their patients, enhance their patient care, while also increasing their earnings and their practice revenue. So when dentists talk to me and they say, Rob, I want to treat larger conditions, I'll say, okay, well, we see when we do medical billing with patients or with dentists, and we see an average revenue or reimbursement from the dental insurance at about $4,500 to $5,000. And I asked them, is something like that? Is that something you're looking towards? And that's always what I hear is yes, something like that, where I can treat larger conditions. And another thing that I hear all the time is I want to add more services to my practice. And maybe you do drill and fill, a lot of drill and fill. Maybe you do a lot of implants, but you want to add some other services. And this is the perfect opportunity for you, because you can add these services. Your patients will absolutely love you, and it will increase your net income. It will. When you do it correctly, it'll increase your net income. One thing that you may talk to others about, but that I hear all the time is, I got to do something about my back pain, Rob. I'm bent over all the time in my dental chair, and it's killing my back. What can I do? Well, treating sleep apnea, not only does it help your patients, it's going to help your back. Okay. And I talk to a lot of dentists that recognize apnea consequences. This webinar is for you, if that's the case. Okay. Next, this is me. I'm putting this webinar on with Marshall from Reveal Solutions. And I noticed that we have, the two of us had common concerns, and we talked about how could we help dental practices more. Because Marshall was already working with dental practices. I was already working with dental practices, and we thought, what could we do to help the dental practices together? And we said, let's do a webinar. Let's show the dentists what opportunity is available out there. We saw this huge opportunity because as you'll see later on, there's so many people with sleep apnea, and the majority of them are not getting diagnosed. Okay, we'll go into that a little bit more in a few minutes, but that's what led us to do this webinar. We wanted to say, hey, dentists, excuse me, what is it that you need? Because we're seeing this huge opportunity. Let us help you grab hold of it. So we decided, let's do a webinar. Let's teach them what they can do. Let's give them actual steps. That's what led it to it. It led us to this webinar. That's me on the left, Marshall on the right. We're family men. We love our families. Marshall's in the Bay Area. I'm in the LA area. We work with dentists all over the country. I personally have, and I know Marshall has too, actually, but I've flown to Connecticut. I've been to Ohio. I've been to Florida, Montana. And by the way, when I went to Montana to help a dentist's office there, -20 degrees. Man, was I glad to get back to sunny Southern California. All right, that's my family. I love them with all my heart. And I do this to help them because when I help you, it helps them. All right. Let me give you a little bit of an apnea overview. It is a medical disorder, and it's when you stop breathing in your sleep. Usually, so the apneic events that someone has, they have to go on for 10 seconds or longer. I saw, actually, Marshall brought this up to me the other day, but I had a dentist that I did a sleep study on, and I used a particular sleep test that showed how long the apneic events were, and I saw on there the dentist only had, well, not only, he had 26 apneas per hour. That's bad. He was in the moderate range. But his apneic events were going on, they would last for 19 seconds each. 19 seconds. That's crazy. I had another one. He was mild, in his sleep apnea. And this was a dentist as well. His apneic events were going on for 56 seconds each. 56 seconds. I don't even know if I can hold my breath that long now. Now, the two main problems are you get no air and it interrupts your sleep. And I always tell dentists, if you want to wreck someone's life, screw up their sleep. Screw it up. Okay? All right. So here's things that we notice. I put these on here. I want you to have these and to be able to grab hold of them and say, okay, I see patients like this. But if you're morbidly obese, 95% of the time you have sleep apnea. If you are, if you have hypertension, if you have diabetes, high anxiety, depression, ADD, ADHD, those things all put you at risk for sleep apnea in a huge amount of ways. This is your typical patient here. Great. Yes, I had a question on here. So what does apnea like? Let me explain. And so when you have sleep apnea, you stop breathing in your sleep. Okay? And that's bad. But imagine blowing out all your air, and then that's when you stop breathing in your sleep. I wish I had time I could show you a video. I don't really have time for it, but I could show you a video of a gentleman. And there was another video I saw of a child. If you go on my LinkedIn account, I have videos on there that I've posted. And one is of this gentleman, and you see him, he blows out all of his air, and then he struggles in his bed. I couldn't even imagine who was videoing this man. Okay. And yeah, imagine doing that and then counting to 10 or to 19 or to 56. Yeah, that's one thing I'll tell you why you end up with some things that you see with an apneic person because of that very reason. So apnea really does ruin your quality of life. It causes all these things: fatigue and depression, weight gain, poor concentration, memory lapses. And what it really does is it increases your sickness. Okay. And then by doing that, it just takes everything over and adds to it. But what we want to show you today is how you can, as I talked about in the beginning, you can use treating sleep apnea with oral appliance therapy to actually save your patients' lives. Okay. Imagine these patients, you're going to help save them in many ways. Let me give you another story here. What you can do is help save their lives. Why you would want to do it? Let me tell you why. Because I had a dentist tell me he had a patient, he treated her with oral appliance therapy for her sleep apnea. And she came in 6 weeks later and said her doctor had reduced her blood pressure medicine. That's phenomenal. And the longer she wore her oral appliance, the less medicine she had to take. Now, I'm not saying that every person that has high blood pressure should get an oral appliance and it will automatically get rid of that high blood pressure. That is not true. That's not what I'm saying. What I'm saying is you could be helping your patients because high blood pressure, heart failure, and all of those things are directly connected to sleep apnea. Okay. While saving the lives of your patients, you're going to also, this is the other thing I wanted you to see. Your patients will love you, but your practice is going to be tremendously benefited from it. This is an EOB of one patient that I had come to a dentist for oral appliance therapy, and the patient came in. We did a sleep study on the patient, and then he had sleep apnea, and the dentist was able to treat him with an oral appliance. Their insurance, this is a real live EOB, okay? Their insurance paid out $11,316.50. $11,316.50. I can guarantee you every one of your reimbursements will not be that. But how many of those do you need to help your practice? If you had one, would you be super excited? If you had 5? All right. So this is, while you're saving their life, you're going to also increase your practice revenue. Okay. Here's another one right here. $9,829.45. You can see the E0486 code upper left-hand corner in yellow. That's the oral appliance. And then the 2 codes down at the bottom, one of them is for an office visit, $220 for the office visit. Here's another one. This one, maybe this is a little bit easier to swallow because it's not as much money. $3,940.45. Yeah, for an oral appliance, $3,900, $4,300. Okay, so those are great things for you to see. Now, here's a gentleman on the right here. This is Reggie White. He's an NFL. He was an NFL great. He lost his life to sleep apnea, and his wife now, she lectures on sleep apnea and what you can do to save it. He was very young. No one should, I guess no one should have to die, right? That's always the adage, old thing, that no one should have to die. It's never easy when anyone dies, but a young person that had a vibrant and could have had a further vibrant life, dying from sleep apnea, if you don't find it, no one else will. And I'll go over why on that. Here's 3 steps. Okay, now is when you want to get out your pen and paper. Okay, grab your pen and paper. Let's get started on what you can do right now to begin treating patients in your practice. First, you got to identify them. If you can't find the patients, you can't treat them. Now, the good news is 90% of those that have sleep apnea go undiagnosed. Okay, so that means if there's 10 people with sleep apnea in one place, 9 of them, no one will ever talk to them about sleep apnea. And from the research that I've done, what we've found is 1 out of every 5 patients has sleep apnea. So if you see patients in your practice, you're seeing patients with sleep apnea, and 9 times out of the 10, no one's telling them about it. That's why you need to assess. You need to find out. Okay, remember, these are things that we look for right here. What do you want to do? You want to find patients that have sleep apnea. You want to assess. You want to hand out a form. In fact, here, let me show you the form that, oh shoot, I'm going to go to this slide in 1 second. I want to show you our form that we use here. We'll get to it in a second, actually. So before we get into it, you may ask yourself, I'm saying, Dr. So-and-so, you need to identify patients in your practice. But you may say, well, why would my patient come to me? I'm a dentist. Why are they going to come to me for sleep apnea? They probably are not going to come to you unless you're advertising that you treat it. They're probably not going to knock on your door and say anything. Now, the patient that I saw this morning did. He asked his dentist, hey, is there any way you can help me? Please help me. And just so happens that dentist has an appliance as well. So why would they want to come to you as a dentist? Let me tell you why. Because no one else, virtually no one else is talking to them about it. Their MD usually is not talking to them about it. Their podiatrist isn't saying anything about it. And wherever else they may go, they're usually not getting talked to about it. And let me tell you this, when you go to a doctor for a physical or for an assessment, here's what's going to happen. Let me tell you, okay? They're going to start at your head and they're going to stop at your nose. They're going to start at your chin and then they're going to go down to your feet. And that's what they're going to assess. But you as a dentist, you look all day long right where the airway is. That's why. And if a patient ever says to you, well, hey, doctor, why are you talking to me about this? Easy peasy. All you got to say is, well, did your doctor, did your MD talk to you about it? No. Why? That's why. That's why. No one else is talking to him about it. Now, dentist and hygienist, the both of you can do these 4 things to check each patient that you see. Ask them a simple question. You can even write this down. Has anyone ever told you that you snore? It's non-confrontational. It's easy. It's and they can answer no, why? Or yes, why? Easy peasy. Ask them that. You can do a Mallampati test. I'll show you that in 1 second here. Why not? If you see lingual stains on the lingual tooth surfaces, excuse me, that could be, that's something you want to look at too. That puts them at risk. Remember, we don't know who has it. We're looking for patients that are at risk. So we're assessing, we're asking, we're checking, we're screening. That's what we're doing. That you've got to identify who's at risk first. And then lastly, if they grind their teeth. One dentist in the field who treats a lot of sleep apnea, he told me, Rob, 7 times out of 10, if they grind their teeth, 70% of the time, they're grinding because they have apnea. Okay. So whether that's true or not, I don't know. But I do know a lot of patients that grind have apnea, and a lot of patients that have apnea grind their teeth. So there's definitely a connection, because remember, when you are not breathing, your body is going to do anything that it can to get that airway open. Okay, so those are 4 things you can do. Here's a Mallampati test. Just quickly review with you. If they score a 2 or a higher, they're at risk for sleep apnea. Their airway's already closed. Their tongue is already larger than their mouth, and they've got issues. So here are some things you can check for in your practice. Snoring, obesity, irritability, depression, high blood pressure. Are they being treated for high blood pressure? Okay, now, this is my assessment form. I use this assessment form all the time in dental practices. Okay, if you need it, email Marshall and we'll get one for you. You do need it, I can tell you that. So first thing we do, we have actually 3 independent areas on the form that show 3 independent areas on there that show that they're at risk for sleep apnea, and each area is independent of the other areas. So they could be at risk in one area and not in the other 2, or at risk at all 3 or 2 out of the 3 areas. So here's the first area here. If they mark yes to any one of these questions, they are at risk. If they're prescribed a pain medication, 75% of the time, it is causing sleep apnea, or they're having apnea because of it. Okay? Here's the next thing you want to look for. When you identify patients, the top part here, you're going to see that's called an Epworth Sleep Scale. And this is the area you want to find out what their score is. So you're going to have them circle the number that they score. Do you fall asleep while sitting and reading, while watching TV, while, and some of the questions are actually sort of silly. Do you fall asleep while lying down to rest in the afternoon? Okay, but this is the Epworth Sleep Scale. It's the national scale. They use it nationally. Insurances love it. Next, and by the way, on that, if they score a 6 or a higher, boom, they're at risk. Talk to them. invite, you know, we're going to go into what to do next, but that's when you want to talk to them, say, look, you're at risk for sleep apnea. We train Reveal Solutions, and we're teaming up, and we train dental practices all the time. And what we do is we not only show you what to do, but we actually get into a lot of how. And because I'm limited in time today, I can't get into so much on how, but I want you to know what to do. So you have steps to follow. Okay. Lastly, those symptoms down at the bottom there, check if you have any of these. If they check off 2 or more, they are at risk for sleep apnea. All of those things are directly related to sleep apnea. All right. So when you identify your patients, you see up to 15 to 25 patients a day. Typical office sees 15. That's 3 or more patients every single day that are walking into your practice that have sleep apnea. And that means you see about 12 to 15 patients a week that have sleep apnea, 40 to 50 patients a month. Are you helping them? Please do. Okay, so now you've identified them and you found that they're at risk. Well, Rob, what do we do next? Well, good. Here's the next thing. Here's what you want to do next, okay? We want to get them tested. Now, there's typically 2 ways to test a patient. Number 1, traditional sleep center. Dun, 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 dun. Does that look like a hotel room? Because it sort of feels like one. What it doesn't show you there is on the other side of that woman to her left, there's a camera there. And it's on you all night. And these sleep techs, they sit back here and they wire you up like this. And they watch you all night. Are you turning over? And and the machine monitors you and they look at the monitorings. Look fun? This lady is ready. She's ready to get tested. I can only imagine how she feels. In fact, so since there's a woman up here, I better tell you that I've heard a lot of female patients really struggle to go to sleep centers because usually, not always, but a lot of times the tech is a man. And having a male watch them all night is really uncomfortable. So that's not on the slide here. I just wanted you to know that. So it is quite intimidating. You can imagine the chest band, the wires, they got to shave your arms and your armpits. Women, maybe that's a good thing for you. Okay. But it is quite intimidating. It's very inconvenient. You've got to leave your house. You've got to go to a center. I had one dentist say he went in and he couldn't get to sleep because there's, I think, 18 to 25 wires on you. I don't know how many it is exactly. But he couldn't get to sleep until 2 a.m. And then at 4:30, they wake him up and say, you're done. And he said, well, how in the world was I supposed to get a normal rest, so you can check my sleep if I only slept for 2.5 hours? And I talked to a dentist just the other day, and he said, it's crazy. When they go to the sleep center, you end up getting 20 minutes of sleep, and then they extrapolate 20 minutes into an 8-hour setup and say, oh, you have sleep apnea, or, oh, you do not. Yeah, I like sleep centers. I work with some really good sleep centers, but it's a struggle. It's expensive. It's like $500 to $600 out of your pocket at a traditional sleep lab, in the lab. And what they focus on is they want to sell, they usually push CPAPs, which means they don't really work that well with the dental partner. And then what that means is you end up with someone who's non-compliant. So this is what ends up happening. You get a CPAP and yeah. Next thing you know, someone's not wearing it because they couldn't wear it from the start. How about a home test? That's easier done, right? Look at this guy compared to the last wires and setup. First and foremost, he's in his own bed. That makes a world of a difference to patients. He's in his own bed. Secondly, it's simple. It's a simple little device. It's got a band that goes around your chest. The respiratory effort belt measures the amount of times your chest rises and falls. Number 2, nasal cannula measures your airflow. Okay? You can see it right there, right on his nose. Even if you sleep with your mouth open, a little bit of air comes through your nose, so it registers it, okay? And then number 3, it's got a pulse oximeter. You've seen this in a hospital or at your doctor's office. This is great because it measures your oxygen saturation levels and your heart rate. So put them all together and you get a sweet little study done, okay? This is one of my patients. This is the test results. This is a diagnostic report, all right? And you can see here 27 times per hour, this patient stops breathing. 27 times per hour. And remember, let me reinforce this because Marshall told me I didn't do it enough last time. 10 seconds or longer to even register on the device. So 271 times or 271 seconds of every 60 minutes. It's not breathing. This patient is not breathing. Okay. Now we can go into all the little things on here, the oxygen desat and all that stuff. But I just wanted you to see this is what a report looks like. Okay. And then what happens is when you work through us and use our sleep testing, we have a board certified sleep doctor, but you always want to have a diagnosis by the MD. Okay. That's why we have our sleep doctor. And he writes on there, or she, depending on who the doctor is, the MD is, our doctor writes on there, findings are consistent with moderate obstructive sleep apnea 327.23 based on an AHI of 27.1. Okay. Now the patient has been diagnosed. Now there's a world of things that you can do that open up to you as the dentist. Okay. And our doctor puts on their recommendations. He always recommends everything to make sure that the patient has every opportunity to get compliant and treated. So he recommends a CPAP, a mandibular advancement device, ENT surgery. Sometimes our doctor will, a lot of times actually, he'll recommend, let me pull this up. I want you to see that a little bit better right there. Good. Okay. And sometimes he'll recommend weight loss as well. All right. And then he signs it, stamps it, signs it. It's good now. He is signed it. The doctor has diagnosed it. Okay. So when you work with us, and a lot of you already do or are wanting to, and we'll get around and we'll help you. We put a home sleep test in your office, and then you can send patients home immediately. All right. So, and then we provide interps when the dentist needs them. So now you want to talk about ahi. And when I talk about ahi, I am not talking about sushi. I am actually talking about AHI, apnea hypopnea index. This is the amount of times the patient stopped breathing and or has rapid breathing that is not getting any air because it's closed, the airway's closed off. Okay. An AHI of 5 to 15 in a person, that means they stop breathing for 10 seconds or longer, 5 to 15 times, puts them in the mild level. And you may think, oh, okay, no big deal. It's only mild. But let me tell you, mild sleep apnea is just like smoking a pack of cigarettes every day. Moderate is actually, I messed up there. It's 16 to 30. Okay. And severe is anything above 30. All right. So that's how you want to look at the test and see it and read it, and that'll help you with it. All right. So now we've talked about how to identify and find these patients that are at risk. And then once you find them they're at risk, then the next step to do is to get them tested. And we like the home sleep test. Okay. It's a great avenue for patients. And then lastly, we have your treatment. Okay. Let's talk about treatment. Let's talk about what we do with the treatment. The one thing you can do to help your patients get treated, and I tell this is a little tip. Okay, I tell dentists this all the time. grab an oral appliance. And I just put one on there. You don't have to use the Moses. I do like the Moses, but there's plenty of devices that are out there that work. Okay. Use an oral appliance and bring in a CPAP mask and hand them to the patient and say, which do you prefer? I guarantee you 99% of the time, I know which way they're going to choose. Okay. Now, if you want to, we're going to teach you really quick here. This is sort of a non-clinical, but a basic understanding of how to treat your patient with an oral appliance. You're going to want to take impressions. Okay. And as you're taking the impressions, you want to take a regular bite registration. So just have them put their jaw in normal, they just bite down normal and take a bite registration. And then you're going to have them do, I like to use something like a George gauge. And I like to, the George gauge, by the way, we could probably get one from Reveal Solutions, can probably get you one. I think they're around $100. They might be a little bit more, might be a little less. Okay. But you use a George gauge and you have them protrude out as far as they can. And then you take a registration of their bite there, fully protruded. And then what you do is you go right to the middle, the 60% mark. Or excuse me, not 60%, right in the middle. And you send that to the lab and you say, okay, I want it here. And if you use the George gauge, you can tell them what percentage it's at. And it's real easy. You actually do the impressions on the gauge itself, the registration impressions, and send them to the lab. Boom, you're good and golden. The lab will then fabricate an appliance for you. I love, there's a couple of really good labs out there. Call us, we'll get you into a good lab that will give you great deal, great opportunity, and they'll fabricate your appliance for you. Then when you get it back, you're going to want to adjust it as necessary. Please do me a favor. Please do not try and fit the appliance and get everything one and done. I know dentists that do that and they do fine with it, but I know a lot of dentists that try that and it ends up, you're not going to get them at the sweet spot in one visit usually. Okay? Usually it's going to take 3 or 4 visits. Take the time that you need. All right? You're going to need to take some classes. Fine. Let me tell you about your classes. They're going to talk to you about the scientific portion of sleep apnea, who has it, why they have it, and so on and so forth. But the business aspect that you need to know is, what are we going to do in our practice right now to find these patients? Rob said get a form and hand it out. Yes, do it. Then you need to know, yeah, we got to get them tested, but where? How? Okay, so Rob said use a home sleep test. In fact, Reveal provides a home sleep test. Great. If that's what you want to do, do it. But classes are great. They're great educational tools. Usually you can get CE credit for it, and it's an opportunity for you to get any clinical questions answered that you may have. Because I'm not as clinically oriented. My focus is, how do you implement it into your practice so that your patients don't feel like they're being sold to, and so that you actually make revenue from it. Okay. Last thing we want to talk about, we're going to focus on here, is we're going to talk about billing medical insurance. Okay, here's the codes you need to know. Write these down. The office codes are going to range. You're going to want to look those up. Okay. If you do a temporary appliance, you can use the 21085 code. If you do oral appliance therapy or the custom fit appliance, long-term appliance, the apnea appliance, E0486. And then if you do a morning repositioner, you'll probably want to use the code 21110. Okay. These are great codes to know. Write them down. And remember, email us if you need those codes. We'll get them to you, okay? I showed you this EOB earlier. I want to show you again. This is why you want to bill medical insurance, because your patients could end up getting treated by you without having to pay anything out of their pocket. Now, I know it says on here, member responsibility, just above that green arrow, $1,978.50. The dentist who treated this patient said, hey, look, $11,316.50. That's enough. We've made enough off of this. That's fine. We've covered our expenses and made profit. We're going to write off the rest. And being out of network, you can, the flexibility is tremendous in your medical billing. Okay. All right. So that's how you want to bill medical insurance. You want to bill it. I threw another EOB on here. I'm not sure why I threw this on here. Some of the dentists I work with, they use cone beams, and we see a good reimbursement for those. But we're going to bill medical insurance. Now, billing medical insurance can be a little difficult, so I want to walk you through a quick way of how to do it. I know I said I don't focus a lot on how, but I want you to understand and have some ideas of how you can do it. Okay. They just recently changed the ICD-9 to ICD-10. It's the first time they've changed since 1979, and they went from 16,000. The American, I can't remember what the insurance is called, but the CPT codes, they went from 16,000 to 68,000, and most of them are just downright silly. I've included a couple here on here because I figured you probably wanted to know that time you got struck by a turtle and your medical insurance wouldn't cover it. Now they do have a code that will cover it. And for all the times that we have contact with a dolphin, we know for sure there is a code for the initial encounter. And it's my personal favorite, and I love that Marshall is on here. If you get a burn due to your water skis being on fire, there is a code. Okay, so just remember there are a lot of codes, and you're going to need to know which ones to use. I gave you a few already to use. Medical insurance can be a bit of a process. It is a process, period. Here's what you need to do, okay? You're going to want to write these things down. You're going to want to submit a W-4 to all the insurances. Let them know who you are, okay? Then when you're getting ready to treat a patient, you definitely want to check their benefits, and you're going to want to check if there's any necessary pre-authorizations. So when I check benefits, I would do something like this. I would call in, spend 10 minutes just to finally get in touch with someone. I'd say, okay, I'd like to know the patient's benefits. Here's our NPI and all that stuff. And here's the patient's insurance ID and their date of birth. And then I check benefits, and then I say, okay, I need to know if there's an authorization needed on the E0486 code. And they'll say, yes, there is, or no, there's no auth needed. And I document that, and then I ask them, can I have I can't remember what the number's called, but they give you a verification number that you actually made the phone call. And I write it down, I document it all. You're going to need to do that. When you want to bill for something, whether it's an office visit and or a home sleep test, maybe you're working with us and now you're going to start billing home sleep tests. So when you do that, you're going to want to submit a HCFA. It's called a HCFA 1500 form. Okay. And you want to submit it with chart notes. Crud, I can't remember the place. Sorry, Marshall, I just now saw your comment. So one of the people on here, Marshall, is actually on here, and he said, if your spacecraft crashes into a dolphin and you ski away from it on fire, then there's a code that will cover each one of those. Okay. So let's talk about submitting your medical insurance. You always want chart notes ready, and I usually like to have them submitted with it so that it's easier to get through. Okay, always document and chart note. Then at the 30-day mark, you're going to check receipt, and at the 60 and 90-day mark, you're going to check the status. Make sure they've got it in 30 days because that's how long technically they have to do it. Okay, and at the 60 and 90-day mark, you're going to check their status. After 90 days, you're going to need to call sometimes and just harass them. It's a process, you guys. Don't expect to be paid for a good 120 days on your first patients. But the good news is once you get this in the kitty, the payments start coming because you're doing more and more and more of them, and you start getting more and more payments, and then it becomes just like your practice. Just like you have with your dental practice. Resubmit it if you need to. A lot of times they'll say, oh, we didn't get it. You got to resubmit it. And you're going to need to appeal as often as possible. Check your payment to make sure that you were paid in full, and phone in if you weren't paid in full. It was only a partial payment. Phone in and appeal it. And if that doesn't work, you're going to write it down. Okay, so phone often. Track everything. Track everything. All right, now let's talk about what you can expect patients that you should be able to treat in your practice. If you see 15 patients a day, 40% of them, actually the number is 80%. 80% of them will be at risk, but 40% of them we're going to count as at risk. That's 6 patients every day that you could test. 50% of them should go home with a home sleep test, and 2 out of the 3, of the 50%, 2 out of those 3 will come back with sleep apnea. Only half of them are going to want to get treated, so that's 4 patients every week. This means you should be treating 15 to 16 patients every month for sleep apnea. Every month. Now remember, if you remember our average, we average about $5,000 per patient in medical insurance reimbursement. Imagine what you're going to be able to do with that. That's astounding. Imagine what you could do with that. Imagine the revenue increase to your practice. And I have dentists tell me, well, but in 6 months we'll have gone through all of our patients. You know what? You're always getting new patients, and you always have patients that said no before that may say no, and that may say yes now. And if you screened them last year and they didn't have it, you got to screen them again because maybe they have it now. And if you're making $5,000 up to $5,000 per case reimbursement, and you're treating 15 patients a month, don't you think you could afford a little bit of advertising? I think you could. You need to start, and you need to start now. These patients, your patients need you. The patients that are all around your practice that don't even walk into your practice need you. Okay? So let me go back to this because I want you to recognize what this could do to help your practice. We already know it's going to save your patients' lives. We already know it's going to save marriages. Okay? We already know it's going to save jobs because they're not going to fall asleep at work as often now. And we know that it's going to lessen the amount of traffic accidents and so forth. So saving your patients, you already know that now. Now look at your practice. It could increase your practice revenue tremendously. Let's say it's only $3,500 a patient that you get per case. 15 patients. I don't even know what that is math-wise, but that's a tremendous amount. What if you got paid $11,316.50 per patient? How many patients would you just treat? 1 or 2? No, you could still treat everyone. I tell you that because the extra revenue to your practice could really actually help you achieve the goals that we talked about earlier. And maybe your goal is you want to have an associate come in. Maybe that's what your goal is. Well, don't you think if you're helping those patients and saving those lives and your reimbursement was up like that, don't you think you could say, hey, I'm going to focus on sleep and I'm going to have an associate focus on drill and fill, or vice versa? Or what about, that I have dentists tell me all the time, Rob, I never get to go on vacation with my family. I don't get to do the things that I want to do. Dentistry is amazing because of the help I get to give, but I'm swamped. I think that there's an opportunity there for you. Now you could help your patients and take your wife and go to Fiji or buy a Lamborghini. Like you can see Marshall there. He doesn't own that one, but his neighbor lets him drive it. But so get a Lamborghini, rent a Lamborghini for a day. Whatever it is that your goal is. I know that you want to save for your retirement as well. What a great way to just start helping your retirement grow. While you're doing what you love, you're saving lives. And for not the first time, but maybe the first time in your practice, your patients are saying, not just, I love my beautiful smile, doctor, or I'm so grateful what you did for my teeth, but you saved my husband's life. Whatever it is, what would you do with that? So remember these steps, okay? There's actually 4 here, but there's 3 main steps. Identify your at-risk patients. What do you want to do? Identify them and assess them. Find out who's at risk. And then why do you want to do it? Because there's a lot of people that are going unchecked. And how do you want to do it? Use a screening form. Quick tip, why not use an overnight pulse oximeter? Marshall and I are at Reveal. We're starting to make dentists use that because it's such a cool tool. You can bill medical insurance for it. Patients love it. It's easy. It's a little wristwatch looking thing. Check with Reveal. If you don't have one, call us up. We can get you set up with one. Okay. Test them. What do you want to do? You want to test them and use, if you can, use an overnight home test. Why? Because they're more likely to do it. How? Show them the test and show them all the wires from the sleep center. That's how. Treat them. Make them an oral appliance. Save their life. And then bill medical insurance and let them reimburse you for it. Let me go back real quick here. Just when you bill medical insurance, will you do me a favor? Will you make sure and bill every office visit? Quick story on that. I had a dentist who we submitted. He submitted to insurance for oral appliance therapy, and they said, well, you need to assess the patient. I did, is what he said. Here, shows it right here. No, you didn't. Yeah, I did. On what visit? And he said the first visit. And they said, well, you never billed medical insurance, so it never took place. So they didn't reimburse it. Bill medical insurance for everything that you do when it comes to sleep, okay? So do you feel a little overwhelmed? I hope that this showed you that it's quick. You can take these steps and implement in your practice. But I know there's going to be quite a few of you that are overwhelmed. Do you need some help? Do you mind if I tell you quickly, really quickly, I'm going to show you a way you can fast track this. We're going to help you. We're going to help you fast track it. Reveal has come up with, we've got a program for you, a package for you, the sleep, dental sleep mastery package. And what we're going to do is we're going to take you through 8 webinars, and we're going to take you to from point A to point Z, right? And we're going to walk you through it. We're going to get into the how with you so that you can know how do you talk to that patient so that they don't, in webinar number 1, screen them and assess them, but no, how do you talk to them so they don't feel like they're being sold to, and instead, so they're like, wow, of course, I'm so glad you talked to me about this. Webinar number 2, we're going to teach you how to use the secret sauce, the overnight oximeter, and we're going to show you the setup and so forth with it, but show you how to hand it out like candy so that every patient gets screened. And that by just doing that, your patients will come out of the woodwork and your practice revenue will increase just by doing the overnight pulse oximeter. Then we're going to show you what to say to your at-risk patients so that they say, I love this. I'm so glad you talked to me about it, doctor or hygienist, because no one else has. And then webinar number 4, we're going to teach you how to get every single patient tested. What if every patient said, oh, of course I'll test. Why wouldn't I? No matter the cost. That's what we're going to teach you. We're going to get you to be the rock star there. Okay. Number 5, we're going to help you understand the test so that when your patients come in and you review the test with them, they're going to beg you to put them in an appliance. And they're going to say, please, just do whatever it takes. Help me and treat me. And then we're going to show you, we have some labs we work with, and they're going to show you how in like 5 minutes, you could take the best impressions to get the best appliance fit for your patients so that every appliance fits perfectly and every patient is super excited to get the appliance. Webinar number 7, we're going to show you how to do follow-ups and get paid for them. Okay. And we're going to show you in webinar number 8, we're going to go through medical billing so you know exactly what to submit to get the maximum payment and to get insurance to pay you, not the patient. So we're going to go through all of that with you. You can see there the combined value. Normally we charge, actually it's way more than this, but we put on here a value of $3,990. That's normally what we're going to charge you. But since you're on this webinar with us today, we want to give you a package. We're going to help you. We've created a package that that you don't see on here. We've created a package. It's $1,995, almost half, almost 50% off, because we want to get you started and get you going in the fastest way possible so that tomorrow you could say, I have a patient, I know what to do, because Rob was on the phone with me and we know where to go. So here's what I want you to do. I want you to go to your email, write this email down, Marshall, MARSHALL @revealsolutions.biz. I want you to email Marshall, and I want you in the subject line put please help or help me. Okay, and then we'll have the office staff call you back, and we'll get you signed up. You can get your credit card, or if you want to pay for a check with a check, fine. We'll get you signed up so you can get going immediately, and you'll see how this works. We've got an unconditional guarantee. So if you feel like the training didn't work, you can keep the pulse oximeters and we'll reimburse you your money back. Okay. By the way, we do give you 2 overnight pulse oximeters to use, to hold till death do you part. All right. So remember, go to Marshall. I want you to do it right now. Go to Marshall, MARSHALL @revealsolutions.biz, revealsolutions.biz. Put in the subject line, please help, and we'll call you up. We'll get you set up and we'll get you going. We enjoyed having you here today. We're excited that you're going to work with us. We hope that you could take these steps immediately and implement them into your practice. And those of you that want to take the next step and work with us, remember, email Marshall and we'll get you going immediately. Okay? Thanks for joining us today. We're going to go ahead and check out. If you have any more questions, feel free to write them in the message box there. If there's no more questions. Yeah, Marshall says, what? They get a free pulse ox even if they say they don't like the training? Absolutely. It's yours. I'll let you have it because I'm that confident you're going to like the training. Okay? You will like the training. You're going to love the training. It's going to work, and you're going to notice immediately that your patients are going to start saying, wow, thank you. All right, so we're going to get stopped there. It's been an hour. I hope you've enjoyed it. You can continue to write messages in here, and we'll message with you. I'm going to terminate the webinar now. Thanks for joining us. We look forward to seeing you and working with you and hearing your success stories. Have a great day. Bye-bye.